So in this video we will be covering the histology of ureter and the urinary bladder. So ureter conveys the urine from the renal pelvis to the urinary bladder. What about the microscopic structure of the wall of ureter? So the wall of ureter consists of three layers, that is the mucosa, the muscular layer and the adventitia. Somewhat like GIT. It has the mucosa, the muscular layer and the adventitia. So we'll see each. So the mucosa is highly folded. You can see it is folded, and if you take a cross section, the lumen is going to be star shaped. And the mucosa consists of, like how we learned in GIT, it consists of lining epithelium and the lamina propria. And the lining epithelium is transitional epithelium. So it is stratified epithelium and it has the capacity to stretch, and it lines most of the urinary passages, especially the urinary bladder and the ureter. So it is also called urothelium. So in this diagram you can see the basal cells. The basal cells is a single layer of low columnar or cuboidal cells, and then we have the intermediate cells, which are the polygonal cells or the pear-shaped cells. You can appreciate it here. These are the pear-shaped cells. On the surface the cells are large and they are umbrella-shaped dome-shaped cells, and some of the surface cells may have two nuclei. And so that is the basal cells, the polygonal cells and the umbrella-shaped cells. That is the transitional epithelium. Muscular layer, there are two layers of smoothness. We can appreciate this is the one layer and this is the outer layer. So the inner layer is the inner longitudinal layer and the outer layer is the outer circular layer. So there are two layers of smoothness. So in GIT it is opposite. It is the inner circular layer and the outer longitudinal layer. So in ureter, in the urinary system, it is different. It is the opposite of GIT. That you have to remember. Then in the lower third, there is an additional outer longitudinal layer. So in addition to the inner longitudinal and outer circular layer, there is an additional outer longitudinal layer. So what is the function of this muscular layer in ureter? Contraction of the muscle is helping in peristaltic movements of the ureter and helps in propelling the urine from the renal pelvis to the urinary bladder. So that is the muscular layer. Then the last layer is the adventitia. So this is the adventitia, that is the outer fibrous coat consisting of the loose connective tissue, and it contains the blood vessels, nerves, adipose tissue and lymphatics. So that is the adventitia. These are the three layers of ureter. So you have the mucosa, which consists of lining epithelium and lamina propria. Then you have the muscular layer, which is the inner longitudinal and the outer circular layer, and the adventitia, which contains the blood vessels and lymphatics fat. So this is how it looks under the microscope. You can see a star-shaped lumen with transitional epithelium and the muscular layer. You can appreciate the inner longitudinal layer and the outer circular layer and the adventitia around it. So if you take a section, if you are looking at higher power, you can make out the transitional epithelium, basal cells, the pear-shaped cells and the umbrella-shaped cells, and the two layers of muscle and the adventitia, okay, with the blood vessels and adipose tissue. So this is how it will look under 10x, and 40x you can appreciate the transitional epithelium, the umbrella-shaped cells and the star-shaped lumen. Okay, so this is how you are going to draw the star-shaped lumen, the transitional epithelium of draw. The lamina propria is extending into it. Then you have the muscular layer, that is the inner longitudinal and outer circular layer, and we have the adventitia where you have the adipose tissue and the blood vessels. So that is how you draw the ureter. Now moving on to urinary bladder. So urinary bladder is a extensible sac which gets filled with urine. It is a pelvic organ and it is a temporary storage site of urine. So the wall of urinary bladder consists of three layers, that is the mucosa, the muscular layer. So you can see the muscular layer, how thick it is. It's a highly muscular organ, and the adventitia. So the mucosa, a muscular layer and adventitia. So you can see the bladder wall, the muscular layer is thicker than that of the ureter. Mucosa, again here in relaxed state, it is highly folded, and the mucosa also consists of lining epithelium and the lamina propria, and the lining epithelium is of the transitional epithelium. Transitional epithelium, you can see the basal cells, the intermediate pear-shaped cells and the umbrella-shaped cells, the dome-shaped or the umbrella-shaped cells. So in relaxed state, this is the relaxed state, it is 5 to 6 layers thick, whereas in stretched state the cells become flattened, the cell's shape changes, cells become flattened, so the epithelium appears to be only 2 or 3 cell layer thick. Okay, so that is because of the change in the shape of the cells that this epithelium is able to stretch. This is one of the important properties of the transitional epithelium. The basal cells, the intermediate cells, the pear-shaped cells and the umbrella cells. And then below that you can see the lamina propria. Coming to the functions of the transitional epithelium. Why is the urinary bladder provided with transitional epithelium? So the apical part of the cells have special property that they can resist the toxic substances present in urine. So they are resistant to the toxic substances, protects the underlying tissue from the toxic effects of the urine, and also it is capable of withstanding the osmotic changes caused by the variations in the concentration of urine. So it is the functions of the transitional epithelium. This is very important. This is often asked in practical exams during Viva. Coming to the muscular layer, so the muscular layer of urinary bladder is given a special name and it is called detrusor muscle. So here in ureter it was two layers, right? It is the inner longitudinal and the outer circular layer. In urinary bladder it is three layers, that is the inner longitudinal, the middle circular and the outer longitudinal layer. The three layers are the inner longitudinal, middle circular, and the outer longitudinal layer. And near the urethral opening of the urinary bladder, so these smooth muscles are arranged in a circular manner to form the internal urethral sphincter, and internal urethral sphincter is involuntary in function. Coming to the last layer, that is the adventitia. So it is the outermost layer of bladder. So you have the mucosa, you have the muscular layer, and then the adventitia, which is the outermost layer. This is the sagittal section of the pelvis where you can see the pelvic organs. This is the pubic symphysis. So from anterior to posterior, the pelvic organs are bladder, uterus, and rectum. This is the female pelvis. Okay, so you can see this is the peritoneum. From the abdominal cavity extends downwards over these pelvic organs in this manner. So these peritoneal reflections over these pelvic organs is very important. The superior surface of urinary bladder is covered by peritoneum. The rest of the urinary bladder is not covered by peritoneum. Okay, so superior surface alone is covered by peritoneum. The part of urinary bladder that is covered by peritoneum, outermost layer will be serosa. So the superior surface of bladder is covered by peritoneum, so that the outermost layer is serosa. Whereas the rest of the bladder, the infralateral surface, the posterior surface, all these are not covered by peritoneum. So the outermost layer is called adventitia, just like how we learned in esophagus. This is the low power view of the urinary bladder. We can make out the urinary bladder is in relaxed state, so there are foldings. You can make out the transitional epithelium, and the most striking feature is this thick muscular layer. So you cannot make out the outer longitudinal and middle circular, but you can make out a very thick muscular layer. So this is how you identify the urinary bladder. There is two slides with transitional epithelium, that is one is urinary bladder, one is ureter. So urinary bladder will have a thick muscular wall, whereas in ureter you can almost see the entire star-shaped lumen, the complete lumen, and the muscular layer is thin as compared to the bladder. This is higher power where you can focus on the epithelium. You can see the basal cells, the pear-shaped cells, and the umbrella-shaped cells. In some surface cells, they may have two nuclei because of the rapid mitotic division. This is how we can draw the section of bladder. We can show the transitional epithelium. The mucosa is thrown into folds in relaxed state, the lamina propria underneath it, and the thick muscular layer, the inner longitudinal, the middle circular, and the outer longitudinal layer, and the adventitia. In the adventitia, you can show the blood vessels and the adipose tissue. Thank you.